The Post just got its hands on a draft, and it looks very similar to the House bill passed last month, with a few exceptions.
For example, the House bill linked federal insurance subsidies to age, while the Senate bill links it to income.
Now, meanwhile, the Senate proposal would cut off Medicaid expansion more gradually than the House bill, but it would have deeper long-term cuts for low-income Americans.
Majority Leader Mitch McConnell intends to present the draft to GOP senators at a meeting tomorrow morning.
Well, despite the secrecy, we are pushing our lawmakers in Washington for details.
That's right. We all want to know what a revised health care plan could mean to you, to your family, to our families.
That's right. Denver 7's Mark Stewart joins us in the studio. You've been working the phones all day to get some answers here.
And that really is the big question. What does it mean to all of us? Late this afternoon, we learned from one of Cory Gardner's staffers cost estimates could be released in the next few days. Tonight, we're asking an expert the questions we all need to be asking to see if such a plan will make our lives better. It's the secret plan hidden somewhere in Washington, D.C. Not even Republican Senator Cory Gardner has seen his party's plan to repeal and then overhaul Obamacare, not committing to a yes or no vote in an interview with Denver 7.
If it's a bad policy, I won't support it. We've got to have, I need to see the legislation. I'm going to read the legislation and find out how it works. So if it doesn't work to reduce the cost of insurance, if it doesn't create market stability, if it doesn't create a sustainable path for Medicaid, that's not going to be something I can support.
As the legislation remains in limbo, Democratic Representative Jared Polis stresses this should not be a rush job.
We need to see what it is, and then we'll see what happens. But frankly, I think there should be a public debate.
Beyond Washington, this is a decision that could impact our lives. We asked a nonpartisan healthcare analyst the questions we all should ask.
What is this going to do to my premiums? And will I have access to coverage to begin with?
So there is the secrecy, and among the theories surrounding the secrecy, Republican leaders don't want to make the legislation open to instant criticism, part of a plan to review it and then vote on it very quickly, Shannon.
Mark Stewart tonight. Thanks.